Thank you so much for having me here. It's such a long day. Thank you for your patience. I am Santosh Dharel, consultant pediatric dental surgeon from Nepal. Today, I'll be going to talk about some of the orodentofacial trauma that I encountered during my hospital practice, and particularly one of the differently presented case, buccal stretch implantation injury of the toothbrush after fall injury. We're going to talk about that. This is the hospital that I work. This is one of the biggest child hospital. And before we move, all the procedures that were performed by me and my team, and consent has been taken to take the picture and to present it for the academic and the research purpose from the every patient's parents. So coming to the introduction, trauma to the oral and maxillofacial regions that comprises the 5% of the all body injuries. And out of that, 90% of those injuries are related to the dental injuries. Like in our hospital setting, we often see those cases like fall injury that lead to the fracture of the tooth. It's a kind of reimplantation we did. Some injuries like this, like palatally displaced fracture of the tooth, head injury. And there are so many different kind of the orofacial injuries that can happen, like the soft tissue injuries, which includes the abrasions, lacerations injuries. It can be alveolar injuries. It can be jaw fractures. It can be dental injuries. It can be nasal fractures, and it can be also the temporomandibular joint fractures. So the analysis done by the ROHL of the 1,500 facial injuries, which comprises that the 5% of the all injuries was occurred the child below the 12 years, and the peak incidence was seen during the puberty and adolescence, followed by the preschoolers. That might be because of the increased unsupervised physical activities and sports. And seasonal variation was also seen, like it was more common in the summer days, and it was more common in boys as compared to the girl. But in the lesser age group, the gender biasness was not present. Etiological factor can be it is mostly due to the fall injuries. It can be by like the sports related injuries. I'm showing you some of the fall injury cases that I encountered. This is the 12-year-old boy. Due to the fall injury, he had laceration on his lower lips, and there was the alveolar fracture along with the avulsion of the tooth. There was another degloving injuries in the 2-year-old girl because of the fall injury sustained on the buccal mucosa. And there is a symphyseal fracture in 4-year-old girl. You can see there is a fracture over there. By using this kind of plate, we call it cap splint. We manage the case, and we often see these kind of the cases of the cut injuries and the charm. Other causes can be road traffic accident, interpersonal violences. This is a case of the road traffic accidents. And it can be because of the child abuse and the domestic accidents. I'm showing you one of the cases. This is a case of the child abuse, violent assault done by his own father to him, like cut injury on his forehead and the malar regions. And there might be, in our context of the area, we can see a lot of animal related injuries. I'm presenting you one of the dog bite cases. And this is a dog bite case that we encountered. So if we see it in a chart, the most of the causes of these kind of the orofacial injuries is because of the fall. and that is followed by the motor vehicle accidents and other causes. So fall are common in children because of the larger to head to body ratio. Like in adult, the head to the body ratio is around 1:8. Whether in case of the newborn and the child, it is around 25%, so 1:4. That might be the reason, that can be the only reason that they fall. When child falls, the first part that going to hit is orofacial region. And another reason might be because of the immature motor skills and the poor balance control. And coming to the topic proper, toothbrushes is the common cause of the impalement injuries that we see in the orofacial region, though it is one of the least used things in the orofacial regions as compared to the spoons, chopsticks, forks, other materials. And those injuries mostly happening in the oral cavity can be because of the oral exploratory behavior. It can be defined by the child developmental stages, like at the first stage, according to the psychoanalytical theory given by the Sigmund Freud. Child tend to explore the environment around him by touching it and by putting it in his or her mouth. And that might lead to the chances of having those kind of the injuries in the oral cavity and the orofacial region properly. So this is one of the palatal impalement injuries that we encountered, but with pencils. So there is a management protocol given by the Andreasen for the orofacial injuries. First, we need to take the initial assessment has to be done, and history taking has to be done. Then clinical examination, radiographic evaluations has to be done. And then first we need to go for the management of the soft tissue, then the management of the dental injuries, then the management of the fractures. Then after that, we go for the post-operative care. So coming to the topic proper, the buccal space implantation injuries. A 4-year-old female child came to our emergency with the chief complaint of accidental fall while brushing at the same morning. This was the presentation of the case. And the history revealed that child slept on the floor while brushing and toothbrush got stuck inside her oral cavity. The parent tried to pull that, but it was unsuccessful. And the history suggested that there was no loss of consciousness, there was no history of vomiting and nasal or ear bleeding, and oral bleeding was present, and it was said to be around 50 ml. And there is no any past medical history, family history, drug history, and general history that is remarkable. And the general condition of the child was well oriented to the time, place, and persons, along with stable vitals. And when we did the general examination, child was very scared and was crying forcefully. We could see that the toothbrush was projecting from the left side of her mouth and the extraoral skin was intact. Intraoral examination showed that the toothbrush had impaled the left buccal mucosa with entire handle protruding from the oral cavity, and there was intact occlusion, all deciduous teeth intact. There was no sign of any fractures and the pathological mobility, and child behavior was negative on Frankel's behavior rating scale. So we did some lab investigations, which was normal. Then first, we explained the parents about the treatment plan and take the consent. But unfortunately, under the local anesthesia, we couldn't retrieve the toothbrush out. Then we planned for the emergency OT under intravenous sedation. Then we made a blunt dissection through the entry point of the toothbrush, and it was retrieved with the dental fraction. We found that the penetration was through the buccinator muscle, masseter muscle, and buccal fat pad. There was no any active bleeding. Then we inspected the wound for the residual fragments. Then we irrigated it with the normal saline and povidone iodine, and then we closed it with the 40 vital suture. This was the retrieved toothbrush. Then patient was put under the observation for 4 hours, and discharged as all vitals were stable, and she was kept under the antibiotic amoxicillin and clavulanic acid and the analgesics paracetamol. And the post-operative follow-up shows that in 10 days follow-up, the patient was, the wound was healed nicely. And 1 month follow-up showed there was complete healing with no any complications noted. This was the initial presentations, and this is on the 1 month follow-up. Coming to the discussion, the toothbrush is the leading cause of the oral foreign body injuries in children, and it mostly affects the age of 3 to 4 years, and there is higher incidence in boys. And common site is the soft palate is the most common site, followed by the flora of the mouth, tonsils, and the buccal mucosa, which accounts around 3 to 13.2% of the cases. In our cases, the impalement was seen in the left buccal mucosa. Predisposing factor can be because of the developmental stage, like they are transitioning from the dependency to the independence, which has increased for the oral injuries. And contributing factor can be because of the improper brushing techniques, brushing while standing or walking, poor neuromuscular coordination, lack of manual dexterity, playful behavior during brushing, or sudden head movement during parent-assisted brushings. As I discussed earlier, this might be the reason why the fall is common. Kumar et al. Has classified the oropharyngeal toothbrush injuries into 3 types: blunt, penetrating, impalement, and the embedded injuries. In our case, we saw the impalement kind of injuries. So for the anatomical consideration, when the toothbrush goes to the lateral side of the ramus of the mandible, it can pierce the masseter muscle, it can pierce the facial arteries, so it can lead to the postoperative swelling, hematoma, and the restricted mouth opening. But if it goes to the medial ramus of the mandible, then it can lead to the serious complications, as a lot of vital structures are being there. So imaging recommendation, normally we do the soft tissue imaging, dental imaging like IOPR and OPG, and CT scan and angiography are recommended. In special cases, where CT scan is recommended for localizing the object and localizing the pathway of the insertions, and angiography is recommended if there is any suspected of the carotid artery injury. For the emergency consideration, we have to rule out the airway obstruction, hemorrhage, and the shock. And for minor injuries, it can be managed in the outpatient basis. In the severe injuries, where there is the presence of the large avulsion flaps, through and through wounds, then it can require the surgery. In our cases, manual extraction was unsuccessful, so the surgical explorations was done. So common complications can be bleeding, hematoma, herniation of the buccal fat pad, and the infections. I can show you some of the cases of the herniation of the buccal fat pad that is because of the toothbrush impalement injuries. Toothbrush was already taken out by the parents themselves, but later on child developed this kind of the injuries at the buccal mucosa. And it is very hard to replace the buccal fat pad inside the buccal mucosa, so we cut and we sutured it. There are so many different cases like this in my clinical practice. And another important complication can be the infection, like the toothbrush has the 10 to the power 7 to 10 to the power 8 bacterial colonies if it is used for more than 4 weeks, which can lead to the abscess formation or deep tissue infections. One case, there was the post pencil impalement injuries. After that, we can see that child developed the bilateral orbital swelling that might be because of the buccal stress infection. And this is one case because of the retained foreign body in the orofacial region, child developed the orofacial sinus tract, When we retrieved, we could retrieve the foreign body as a bamboo stick, 2 pieces of bamboo stick from his cheek region. That is the case. So this is one case. In the case of the cerebral palsy child, child fell down and the parent neglected the injury, which led to the oral meiosis case. We can see a lot of worms inside the child palate. So though the clinical scenario, clinical cases are very insignificant, but the complication that can arise can be life-threatening. So other serious complications can be palatal or pharyngeal injuries or carotid artery damage and thrombosis. So for the preventive approach, prophylactic antibiotic is recommended. And in this case, we also prescribe the oral antibiotics. So for the management overview, there are very limited cases reports and there is no any standardized treatment protocol established yet. So the general management principle is the thorough clinical assessment, careful foreign body removal, TPS irrigation, wound closure, and antibiotic and analgesics. In case of the older wound, it is leave open for the secondary healing. In case of the recent clean wounds, it is advised for the primary suturing, and radiographic evaluation is advised. Mostly the soft tissue evaluation is recommended and indicated CBCT and the angiography if there is the suspected case of the thrombosis. So the home message to take the message from this presentation is they ensure that brushing should be done under the parental supervision, and we should encourage the careful brushing habits and discourage children from running or playing while brushing and placing object in the mouth during play. And the most important thing is if it happens, an impairment happens, it is not advised to remove those things at home. Because it can lead to the serious local and the systemic complications. So timely medical intervention is crucial, and proper post-operative oral hygiene is very important for the uneventful healing of the every orofacial injuries. I would like to acknowledge my Department of Dentistry, Anesthesiology, Pediatrics, and the surgery for doing, managing so many different orofacial injury cases in my hospital. These are my references. Thank you.